All right. Hi, everyone. Welcome to Torrance Adult Schools Resource Week, Day 2. Today, we'll be focusing on healthcare and wellness. We have some really great speakers, including Cover California, My Health LA, some clinics that are going to be presenting the resources that they have available for you and for our community. Before we get started on that, give me 1 second. Oh, okay. Like I mentioned, we will have Cover California, My Health LA, the South Bay Family Health Center, Home Instead Senior Care, and then Torrance Adult School will be speaking a little bit about the services that we provide. But before we get to that, I just want to mention, for those who don't know, there is a 211 number, also known as 211la.org. And on this website, you will find different resources that can help you, including medical care, insurance information, as well as food and housing information if you need that. So make sure to save this link in case you ever need some resources. This is a great resource. You can also you can also dial 211 and get information that way. For some of our students or community members, just in case you guys don't know, here are some local clinics that you can visit that often serve low-income families. We have the South Bay Family Healthcare Center, which we'll be presenting today. They're located in Redondo Beach, Gardena, Carson, and I believe they also have an Inglewood location. And then on the right, there's the Northeast Community Clinic. They have a location in Hawthorne, and Harbor City. They also have other locations as well. And then there's the Behavioral Health Services Family Health Center. There are also other centers that you can visit, including the Torrance Health Center, the Harbor UCLA Family Health Center, and the South Bay Children's Health Center. You can find more centers or clinics through the Department of Health Services website, which is right here, dahs.lacounty.gov/MHLA. So if you are looking for a center that's closer to your home, just visit this website and you'll be able to find that information. Here are some local hospitals for those who are not from here, are new to this area. We have Providence Little Company of Mary, Torrance Memorial Medical Center, the Children's Hospital, Harbor UCLA, and Kaiser Permanente. All right, so just to jump right into our speakers, today we have Nahun Mancia, right? Who's going to be talking about Cover California, as well as covering a little bit about Medicare and Medi-Cal. So Nahun, whenever you're ready.
Perfect. Thank you very much for having us. My name is Nahun Mancia. I'm actually one of your local agents here in Torrance, actually located on Hawthorne and 186, very close to South Bay Galleria Mall. So without any further ado, let me get started with the presentation here. So we're going to start with Cover California. Cover California is actually the marketplace here in California, the marketplace for where you can buy insurance at a lower cost. And the reason it's a lower cost is because there are certain discount or tax credits that are paid. Let me see here. Start your video. I got a pop-up message saying start video.
Oh yeah, so you can start your video. That would be great.
Okay. Okay. So let's see. Okay, you can move to the next slide. Okay, perfect. Okay, so going back to what I was saying regarding Cover California. So when the Affordable Care Act or the healthcare reform went into effect in 2014, states were given the opportunity to either create their own marketplace or participate in a federal marketplace to offer affordable insurance, health insurance. So California decided to create their own, and that's why it's called Covered California. So Covered California itself is not insurance. So Covered California is the marketplace where you can go and buy affordable health insurance. Plans such as Anthem Blue Cross, Kaiser, Blue Shield, HealthNet that you could buy direct with the companies. You could buy through Cover California, but you'll get assistance to pay less per month. So, yes, give me just a second here. Having technical difficulties.
Just give us a second as he comes back. But throughout the presentation, if you guys do have any questions, just type them in the chat box. Veronica Nieves is on the chat. She's our counselor and she will be able to answer your questions. So Nahum, are you ready?
Yes, ready. I'm back here. Okay, so so some of the eligibility requirements to qualify for assistance with Cover California, as you can see on the screen, you have to be a California resident or have the intent to reside in California, be a U.S. citizen or have lawful presence in the U.S. And the income has to be above 138% of the federal poverty level, because anything below that would be considered for the Medi-Cal program. And I'll go into details about the Medi-Cal program in a bit. And the other thing is not being incarcerated. So, because there's usually healthcare in if you're incarcerated. So now, as far as a note here that I wanted to bring up, prior to the Affordable Care Act, plans were able to deny coverage to individuals who are applying based on pre-existing conditions. All of that was eliminated by having the Affordable Care Act go into effect. So that's a good thing. So now anyone who has any medical condition like asthma, diabetes, or cancer could get coverage and get the treatments they need without any denial. So next. Okay, so a little bit more about the requirements. So income is a factor, household size, and I want to clarify what this means because a lot of people get confused about household size. It's not everyone who lives in at the house. It has to be the household size is determined by tax filing. So say for example, if I'm a single parent and I have a child as a dependent, then my household size is 2. Okay, and even though I may have a brother who also has a wife and a kid at the house and things like that. So even though there's multiple people there, but household size is determined by tax filing. So just making that clarification. Also, the age is a factor, location, because every county has different rating regions. So for example, in LA County, we have the northern part of LA County, which basically think of like a invisible line from San Fernando Valley north of that, including Antelope Valley, Lancaster, and so forth. And below that is the southern part of LA County. So 2 different rating regions. And the zip code is what helps us determine which region you're in. The other thing too is not to have access, other insurance access, such as insurance through work, or if you have Medi-Cal or Medicare, or any other insurance that meets the minimum essential coverage requirements. Okay, so that's that. Let's keep going. Now, this is the table that we use to determine which program you qualify for. On the left-hand side, on top of where it says FPL, that's federal poverty limit, but those numbers from 1 through 8, that would be the family size. And then horizontally, you'll see that the income. So as you can see there, the 138%, anything less than that would be considered for Medi-Cal. So for example, for a family of 2 who makes, let's say, 23,500, because that's below 24,040, they'll qualify for Medi-Cal, the adults and children. But anything above that, Now we're talking about Cover California because you'll be getting some assistance because your income is still low. You'll still be getting some assistance to pay less per month and still get up to 94% coverage for your healthcare services. Just to clarify that there. Keep going. Perfect. So these are some of the brand names that we have access to Cover California. So you can see here some of the ones that you may recognize: Anthem Blue Cross, Blue Shield, Kaiser, and Health Net, and some other ones there too. That like Oscar, for example, they're fairly new, a few years back. All right, let's keep going. Okay, perfect. So this slide here is important because this you can see here that there's 4 levels of coverage. For example, bronze. Okay, that covers 60% of the cost. You can think of this coverage as 60-40. Okay, 60% is covered by the health plan, and 40% would be your co-insurance. But the good thing is that with this co-insurance, there is a limit. They call it maximum out-of-pocket limit, and it's an annual limit. So, for example, with bronze, the limit might be for this year is $8,200. Okay. Now you may say, well, $8,200 is a lot of money. Okay. Well, the thing is, the bronze is because it's the lowest coverage, is also the lowest cost depending on your income. There are some people who pay $1 for bronze. Okay, so I always tell my clients, okay, is if you're deciding not to get insurance, at least get bronze, because I'll tell you why. I had a client who had open heart surgery, and they had bronze. Okay, their bill came out to $330,000. Okay, I know $8,200 is a lot of money, but $330,000 is a lot. Okay, it might be easier to pay $8,200 than the other amount. In addition to that, I would say that whenever you have a situation where you have a hefty bill, always look for, ask the hospital to see if they can help you. Some of those hospitals are nonprofit, so they may have charity programs that may help you lower the bill or maybe give you a payment plan. So anyways, the next level is silver. That covers 70%, and gold covers 80%. Platinum covers 90%. So the higher the coverage you get, the more you pay per month. Okay. Now, so there's 4 standardized coverages. So bronze, silver 70, gold 80, and platinum 90. But then if your income is very close to that 138%, there are some enhanced benefits that you may get, which would be, for example, 73%, 87%, or 94% coverage. And not only are you getting a subsidy to lower the monthly cost, but you're also getting a subsidy to lower the co-pays and deductibles within those plans. Okay, so next. Okay, so this is more about those enhanced silver benefits that I was telling you about. So, for example, let's see here. Well, I think we already covered this. So, just to kind of give you a little nugget here. So, typically on a silver 70% coverage, the copay for the doctor is about $35 to $40. Okay, if you qualify for a silver 94, that $40 is dropped to $5. Okay, the deductible, which is usually $4,000, drops to $75, and the maximum out-of-pocket limit or the cap for the year, which is usually $8,200, drops to $1,000. Okay, that's because your income is low. Okay, and you're getting the most help you can get. Next. And this just gives you more details for each coverage. As you can see here, what I was referring to on silver 94. Okay, where it says medical deductible towards the bottom. You see there on silver it says these are the benefits for next year, so they're a little different. But $3,700 deductible, $75 on silver 94, and $35 copay for primary care visit, $5 on silver 94. So just to kind of give you a little visual on that too. So you may want to take a screenshot of this in case you decide to do the shop and compare tool on the Cover California website. That way you can get a side-by-side comparison of the different plans that you may see there. So next. And as far as the dental benefits, you are eligible to buy dental through Cover California. It kind of works the same as when you get insurance through work, where you have to buy dental, vision, and medical separately. It's the same process here. So you're able to buy from these companies, you know, Anthem Blue Cross, Blue Shield, Delta Dental, and some of the other small players as well. So there are both HMO and PPO, okay? HMO ranges from about $8 to about $16 a month per person. PPO anywhere from like $44 to about $56 per month per person. So just to give you the idea. Next. Okay, and these are just like this. So one thing too is for the HMO, there's no waiting periods or annual limits. These dental HMO plans tend to be more like a discount type of program, where if your dentist accepts it, you might have access to discounted costs for dental services. Dental PPO, they have a yearly benefits. In this case, it covers about $1,500 per year. There are deductibles, and there is a 6-month waiting periods for major services. So, for example, if you need to have, let's say, an extraction or root canal, you would have to wait until 6 months. So, but if you have had continuous dental coverage, let's say, for example, you lost your job, but you have dental, then you could actually get credit from that coverage and provide that proof to a new plan, and they'll waive the 6 months. So that's a good thing to know. Next. Okay, you can also buy vision here. We offer DSP and IMED, and again, this the cost may range from about $16 to about $20 a month, depending on who you choose, and you'll have access to discounted services through their networks. Next. All right, so this is actually the periods that we're currently in. Renewals for existing clients started October 1st, and it runs through December 31st. You might, if you're currently enrolled in Cover California, you must have gotten a letter saying that if you don't do the enrollment yourself by a certain date, the system will do the auto renewal for you, okay? In the event that it's important that you take a look at those letters, because in the event that there's an error when you get the renewal, get in contact with your local agent or Cover California to make sure that you correct it before the 15th of December, so that those corrections are already in place for the 1st of January of 2022. Now, open enrollment is mainly for people who don't have coverage, for someone who's starting applying for the first time. So that runs from November 1st until January 31st, 2021. Next. Now, there are certain exceptions to the rule. Like, for example, open enrollment happens once a year. But let's say, for example, that you had insurance through work and you got laid off, or they decided to cancel the benefit. Well, that opens up that opens up a special enrollment period, which is a 60-day window where you can enroll in Cover California and get that plan that works for you. So as you can see here, there's multiple special life events that trigger a special enrollment period, such as if you moved to a different county, that's one, okay? If you, like right now, wildfires have been affecting a lot of people, so that created a special enrollment event. When someone turns 26 and they're no longer eligible to be a dependent on their parents' insurance, well, that also allows them to jump to Cover California and so forth. I mean, this is a good slide to maybe take a screenshot in case you wanna have it for reference. So next. All right. Now, this is what I referred to earlier. This is the shop and compare tool. If you go to Covered California. If you go to coveredca.com, you'll be able to click where it says shop and compare, and this form will come up. It's very straightforward. You can choose the year that you want to get the benefits for. Right now, since we still have December, you can still, if you have a special enrollment event, you could still enroll for November 1st. But if you're shopping for plans for 2022, you just have to choose that there. It's very straightforward. Zip code, your annual income, taxable income, and age and zip code, and that's basically it. Next. And now, if you decide to apply, there's different ways you can do it. You can do it yourself by going to the website, Covered California. You could call, they'll enroll you by phone. You can find a local agent such as myself, and we can help you enroll in person or by phone. So there's different ways, okay? Now, one thing to clarify, a lot of people sometimes feel that if they go with an agent, that they may end up paying more than if they were to do it by themselves, and that the answer is no. The assistance that you get is at no cost to you, and the price for the plan that you choose, whether you do it with an agent or directly, is the same. The healthcare reform actually made it so that the agents already, they get compensated through a different way through that program that has nothing to do with what you pay for the insurance. So next. And just a reminder to the penalty. I know a lot of people think that there's no penalty for not having insurance, but California actually implemented it as of January 1st, 2020. So it's actually going up for 2022. So if you didn't have insurance in 2021 when you file taxes in 2022, it would be at least $800 per adult. Or if your income is higher, it could be 2.5% of your income for the penalty. So if you want more information, just go to California Franchise Tax Board, and they'll have a penalty estimator tool where you can enter your details there, and it will tell you how much the penalty will be for someone who didn't have insurance. Now, one thing too is that you have a 3-month exception, okay? So if you have 3 months of 3 continuous months without coverage, but then you get coverage, then you're exempted. And then let's say, for example, you were without insurance for after those 3 months, you had 3 months of no coverage. So the way it works is you get charged a prorated penalty. So the amount is divided by the number of 12 months, and then you're charged a per month penalty for the months you didn't have insurance. Next. Okay, and actually, could you go back to the last slide? Oh, okay. Okay, so sometimes you may think, maybe I'll just go without insurance and I'll just pay the penalty. But again, what is the worst penalty someone may have? I mean, if you have a hospitalization and have thousands and thousands of dollars of expenses, I mean, that's the worst penalty to have. And sometimes you may be surprised, you may be eligible to get maybe a bronze plan. You avoid a penalty and you have at least some basic coverage. Bronze, besides doing its job, which is covering you for major expenses, also gives you 3 doctor visits per year for $65 per visit. And it also gives you your preventive, which, for example, your wellness, your physical exam every year, your flu shot, cancer screenings, and labs. Those will be included. So you get something, and in some cases, if your income allows it, it may be even no cost for next year, because if it's $1, the state, if it's $1 per month, the state actually approved a program that will pay for that $1. So a lot of people will be getting coverage at no cost for next year. So just to throw it out there that it might be worth looking into getting insurance to just avoid a penalty and possible medical bills. So that's that. Thank you so much. Let's go. Okay, so the next thing would be Medicare. and this is just going to be a high level overview of Medicare because it can be very intricate. So if any of you have any further questions about Medicare, please feel free to reach out to me and I can get more specific, because every case is different. So we want to make sure that we respect that as well. So next. So Medicare, now this is the card that a Medicare beneficiary would receive once they're eligible for the program. So this is the most updated model of the card, or design, I should say. What is Medicare? Medicare is a program, an insurance program for people who are 65 years of age or older, okay? Or for individuals who are younger than 65 who have certain disabilities, or people with end-stage renal disease, or ALS, or amyotrophic sclerosis. Now, this program, in order to enroll, you have to do it through Social Security, through the Social Security Administration. Now, the thing about, I guess, the thing here is these programs, if you don't join them, then you have penalties, so as you can see. So when you're first eligible for Medicare, specifically Part B, if you don't enroll, when you're first eligible, you may get a penalty up to 10%, actually 10% for every 12 months that you didn't have the coverage and you were eligible to get it. So next. Okay, now one thing that I want to point out, whenever you're researching about these programs like Medicare, Medi-Cal, or Cover California, it's always good to go to the official government websites, okay, because sometimes there's a lot of sites that will just ask for your information and they'll start selling that information. And next thing you know is your phone is blowing up with telemarketing calls. So it's always good to go to official government websites so that you can get the most, basically with that trusted source. Now, on the left-hand side here, this is the Medicare EU handbook that every Medicare beneficiary gets on a yearly basis. This is sort of like the Bible of Medicare for the members, for the beneficiaries, because it tells them the new associated costs with the program. So now one thing about this too is I'll be making reference to the bottom link, which is for LA County Department of Public Social Services, specifically for the Medi-Cal program later on. So next. Okay, so who's eligible for this program? So as soon as someone's turning 65, they also must have paid into the program. So it's basically 10 years of full work or 40 quarters of a year, which is also referred to as 40 credits. Now, if someone is under age 65, they need to have been qualified as disabled by the Social Security Administration and have received Social Security disability for at least 24 months. So on the 24th month, the Medicare program will become effective, okay? And the next one is end-stage renal disease. This would be for someone who has kidney problems, and they would qualify for this program. And basically, if they have ESRD, their Medicare becomes effective after, the first day of the 4th month of having dialysis. Next. Okay, so the ABCs of Medicare. So one thing to note about Medicare is that it's all about letters. It's sort of like an alphabet soup, especially when we talk about, Part A, Part B, C, and D, and then we talk about the mid-subs, which also have plans that range from A to N and so forth. So it can get a little confusing. So this is, in a nutshell, Part A is hospital insurance, specifically inpatient, okay? Part B is basically all your professional services, such as doctor, specialists, labs, ambulance, and as you can see there, that therapies like physical therapy and so forth. And Part D, now, before I get there, Part A and Part B, as soon as you turn 65 and your Medicare becomes effective, even if you do nothing, it will become effective. So that becomes That's called original Medicare, okay? If you just let it sit there and then you happen to need services, if you take that card, you'll get services, okay? Because you have original Medicare. Now, the other part, which is Part D, that you have to actively enroll when you're first eligible. And that's, you have to basically, Part D is a prescription drug plans, the options of that. Now, those prescription drug plans are offered by private companies, okay? So some people sometimes miss enrolling into a prescription drug plan and they don't have access to drug coverage, okay? Because this program, the Part D, covers generic drugs, brand name drugs. It gives you access to a pharmacy network and so forth. Well, next. Now, all of these parts do have costs, okay? Part A has a cost, but because you worked and paid into it for about 10 years, by the time you get it, when you turn 65, is usually at no cost to you, okay? But for someone who didn't pay into it, that could cost them about $471 a month, okay? So Part B does have a monthly premium. For 2021, the premium is $148.50 per month, and it could be higher actually for people with higher income. Okay, Part D that ranges because it depends on the plan that you choose. Okay, there are plans that are very inexpensive, but again, if you have higher income, in addition to the plan premium, you pay an extra cost just because you have higher income. So, now, what are other costs associated with these parts? Okay, so there are hospital inpatient deductibles for Part A and co-insurance. Okay, like the deductible, just to give you an idea, it's upwards of $1,400 for every benefit period. Meaning, and every benefit period is 60 days. So if there's a hospitalization, let's say January, and then there's another one, let's say in June, you have to pay that deductible twice, you know, and then any associated co-insurance or co-pays with the days that you were in the hospital. Part B also has a deductible. It's upwards of $200, and after you meet the deductible, the Part B covers 80% of the cost, and you are responsible for 20%. Now that 20% is open. So let's say, for example, 20% of $100 is $20, but 20% of 100,000 or more, you figure it's thousands of dollars, right? So we're gonna be talking about ways to control those costs. And Part D, same thing: deductibles, co-payments, co-insurance, and they all vary by the plan that you choose. So next. All right, so these are some of the ways that we can contain the cost, okay? So I know on TV you might see a commercial saying Part C, Medicare Advantage, so forth. Okay, so Part C, think of Part C as coordination, okay? So Part C is also known as Medicare Advantage plans or MA plans, and it's another way to get Part A, B, and D coverage in one plan, okay? Coordination of care, including network of primary physicians, specialist hospitals, and it also offers services that original Medicare doesn't. For example, vision, hearing, fitness programs, dental, and so forth, or foreign travel emergencies, things of that nature. And if you join a Medicare Advantage plan or Part C, the premium can be as low as $0 per month. Okay. The only thing you have to pay is Part B, which is the $148.50, which that's paid to Social Security. So that everybody has to pay, unless they qualify for other programs, which we'll go into later. Now, as you can see there, it's simple. The way I picture it is you have Part A, B, and D, and it's all packaged into Part C, and it's at no cost. Then the next option would be a little more expensive. So this is basically, as you can see at the bottom, I put a little formula there. You see original Medicare, which is Part A, B, okay? And because you have deductibles and you have co-insurance and that 20%, well, you buy a Medigap, okay? Medicare Supplement Plan or Medigap. Medigap is a Medicare supplement insurance that helps fill the gaps in original Medicare, helps pay Okay, helps pay for the remaining healthcare costs like co-payments and so forth. So this can be a little expensive, upwards of $200. So, costs may be adding up. So next. All right, so we're gonna skip some of this. This is actually some of the programs that you can qualify for, such as Medi-Cal, and for Medi-Cal you apply through your county office, LA County office, and for extra help to pay for your prescriptions and also to pay for the Medicare premiums. This you do it through Social Security and the counties. Next. All right, and you might be asking, okay, how come all these plans, like especially Part C, offers all these great benefits, and how do they do it? Okay, well, all these plans are rated from a 1 to 5 star, and the higher the rating they have is the more funds they get from the government to enhance the benefits, and that's how they can enrich what they offer so that you can have access to a better coordination of care. Next. All right, so this is just open, like some of the different days that you can enroll into a plan for Medicare. So the first time is when you first turn 65, you have a 7-month window, 3 months before, the month of your birthday, and 3 months after, so 7 months. And the annual election period, which we're in right now, is October 15th to December 7th. And then you have another option to make one change from January to March 31st. Next. And this is just a comparison of what we talked about, kind of like a summary. You can see that under Medicare Advantage, you get more benefits and more services compared to the other options as well. Next. And this is it. So this is my information. I know I went a little longer than expected, but if you have any questions, please take a screenshot of this slide and give us a call. We can answer any questions you may have, whether it's Cover California, Medi-Cal, or Medicare. Okay, we're specialized in those areas. So, and that's about it for me. Now I know I saw someone else a question. I don't know if it was already answered too. Let me see.
I saw a question too. It was about someone had their COBRAs ending soon. When should they apply? It ends in February 16.
Okay, perfect. So if your COBRA is ending in February 16th, you can start applying or searching for insurance as soon as January. Okay. Unfortunately, with the plans here, we cannot get coverage to start, let's say, February 17th. The coverage here only begins the first of the month. It's from the first to the end to the last day of the month. So you could get coverage even if there's an overlap of half a month. You could get a plan that starts February 1st. Okay, and because you have a special, this open enrollment that we're in right now doesn't apply to you because since you're losing COBRA benefits, it opens up a 60-day window for you to join a plan through Cover California or privately. So give us a call. We can look into that for you and give you more information on. I see here it says it's just for myself. I'm still unemployed. Okay, so give us a call. We might be able to give you more information. You might qualify for insurance at no cost as well. So a lot of things to look into, but we can help you with that.
All right, thank you, Nahun. And if ever anyone has any questions regarding Cover California Medicare, his address is right here. So he's located not too far from us, and his cell phone and emails here too. If you guys do want to learn a little bit more about Medi-Cal, Medi-Cal Department of Social Services, Public Social Services will be presenting tomorrow at 12 as well, in case you guys want to learn more. But again, thank you, Nahun. We do need to move forward because we have our next speaker.
My pleasure. Thank you for the invitation.
No, thank you. All right, so here, Cynthia, whenever you're ready, we have Cynthia from My Health LA.
Hi, can you hear me?
Yes.
Okay, perfect. Hi, everyone. My name is Cynthia Lopez. I am the staff development specialist for the My Health LA program. Next. What is My Health LA? My Health LA is a primary care program funded by LA County. Something that we do stress is that it's not a health insurance. It's a health program. We currently have 52 contracted community partner clinics, which give us over 220 sites across LA County. Next. Who is My Health LA? Here are a few of our numbers. As you can see, it's broken down into gender, age, language, and race. And gender, we have 60% of our members are women and 40% of our members are men. Race, we have about 95% Latinos. Next. This is a breakdown of our districts. LA County has 5 districts. District number 1 has a total of 36,791 members. The second district, which is our biggest district, currently has 46,374 members. District 3 has 23,000, District 4, 14,000, and District 5, 11,000. And the undetermined would be our homeless population, which is approximately 3,589. Next. What does My Health LA cover? It covers preventive healthcare, medications and basic lab, specialty, urgent, and emergency care. Next. Who is eligible for the My Health LA program? There are 4 requirements. Number 1, uninsured and not eligible for public insurance. Basically, what that means is that you cannot have private insurance. Either you purchase it through Covered California, or you purchase it through your employer, or you go directly to the health insurance. Or if you have Medicare or full scope Medi-Cal, and there is a difference between full scope and restricted. But if you have full scope, you're not eligible for the program. 2, you have to live in LA County. So you have to be a Los Angeles County resident. 3, there is an age requirement of 26 and older. And your income has to be at or below 138 of the FPL. We do require verification of income and verification of residency when you apply for the My Health LA program. Next. Enrollment in the My Health LA program. We currently have about 130,000 participants in the program. We use a county-based program that determines eligibility, and it's called One App. A person is enrolled in My Health LA as soon as the application is completed in the One App system. So we do get a same-day approval. There is no waiting period. The moment you schedule your appointment to see a certified enrollment counselor at one of our over 220 clinics, you are approved the same day. Something that we do stress is that personal information is not used for immigration purposes, only to determine your eligibility. There is no cost to apply for the My Health LA program or to reapply at any point. Next. Enrollment in the My Health LA. This is a chart of our fiscal year from 2020 to 2021. As you can see, our numbers have dropped dramatically, and one of the main reasons has been COVID. So hopefully this information does help you, or you could relay this information to someone that might know that is in need to apply for the My Health LA program. Next. My Health LA medical homes and renewals. A medical home is a clinic where participant receives all of their primary and preventive care. My Health LA participants select a medical home when they enroll and keep their medical home for 12 months. Participants must renew their My Health LA at the end of the 12 months and can change their clinic at that time. A participant can also change their medical home if they move or have a life-changing event and need a new clinic. So basically, where you go and you apply, that would be your medical home, and you would get all your services done in that particular medical home. You can change it if, let's just say, for example, you select a medical home that is in Torrance, because that's where you reside, or that's where you work. So you selected your medical home in the city of Torrance. You now move to Alhambra. From Alhambra to Torrance, it's about an hour drive, or a little bit longer with traffic. So you don't want to commute about an hour to get to, to your clinic. So you call member services and you request a medical home change because you have a life-changing event. You moved. So that would give you the opportunity to change your medical home. Next. My Health LA ID card. All of our members receive the My Health LA identification card. This is the card that the member presents at their medical home to receive their services. Participants keep the same card even after the renewal. Participants get a new ID card when they change their medical home. And only at that point do members receive a new medical card, because if, as you can tell, the medical card does give you the name of the medical home that is assigned to you. And of course, if you lose or if your card is stolen, you can always contact member services to request a new card. Next. My Health LA disenrollment. Participants who no longer meet program eligibility requirements or who do not renew every 12 months will be disenrolled from the program. Participants can voluntarily disenroll at any time. There is no cost to apply for the My Health LA program or to reapply. Next. Medications. Participants have prescriptions filled in your clinic's dispensaries or pharmacies or a retail pharmacy within the My Health LA pharmacy network. We currently have over 800 pharmacies, and some of our patients do qualify to have their medication sent directly to their home or to their clinic. Next. Next.
Cynthia, are you still there? Can you hear?
Yeah, I can
Okay.
hear you, but I'm still on the same screen. I don't know if everybody else is, but I'm still on medication.
Okay, let me froze for a bit.
Did it freeze? Oh, there we go. Dental. There we go. We're good. Some of our clinics do offer dental services. If they do, My Health LA participants may get free dental services depending on the availability. My Health LA participants can receive dental services at any of our My Health LA sites. Next. Specialty, emergency, and urgent care. My Health LA participants can go to a DHS facility for specialty, emergency, and urgent care. A My Health LA participant will be screened for Medi-Cal and other coverage programs. Failure to comply with the Medi-Cal application process may result in the patient being financially responsible for service rendered at a DHS site. Patients receiving their primary care at a DHS site should not sign up for My Health LA. My Health LA is a primary care at a community clinic only. Next. Mental health treatments. DMH, which is the Department of Mental Health, has many different types of mental health treatment services and are provided free or at a very low cost to the My Health LA members. You can receive these services such as individual and group therapy, psychiatric medication support, case management, intensive mental health services, and you can also call the Access Healthline at 1-800-854-7771. Next. Mental health prevention. Mental health prevention services at the clinic. So these are services that you can receive directly at your medical home. Stretch management, grief and loss, trauma-informed care, group and individual visits, and all this can be done either by phone or in person. Next. Substance abuse treatments. My Health LA participants get free sub-treatments, such as outpatient treatments, residential inpatient treatments, detoxification services, and withdrawal management, opioid treatment programs, medications for addiction treatments, recovery support services, and case management. Next. My Health LA participants can receive sub-treatments for free. There are 4 ways My Health LA participants can obtain sub-treatment services. 1, by calling the Substance Abuse Service Helpline, also known as SASH, at 1-800-844-8255. 804-7500, or by visiting the website at ph.lacounty.gov/SAPC. By referring to a SAPC provider directly, by receiving sub-services by the clinic, by referring to a field-based services. So the clinic can also refer you directly to those services. Next. My Health LA member services. This is a line strictly designed for our members and for anyone that is interested in applying for the My Health LA program. They're open to any questions about the program. Their hours of operation are from Monday through Friday from 7:30 a.m. and to 5:30 p.m. And the number is 1-844-744-6452. And we do have interpreters available if needed. Next. This is a screenshot of the My Health LA website, where all of you are welcome to visit. If you need to get an address of one of our facilities, you can easily go onto the website and select the select the web browser that says find a clinic. From there, it will prompt you directly to the DHS site, where you could type in your home address or type in your zip code, and it would give you a list of all of our clinics in that area. You just want to always call the facility and make an appointment with a certified enrollment counselor, just to make the process a little bit easier, and you won't have to wait such a long time. Take your verification and ID and a pay stub. If you do not have a pay stub because you are paid in cash, there's forms or a letter that you can submit directly from the employer. We're always happy to help. And we all know that it's going to be on a case-by-case basis. So just call and talk to a certified enrollment counselor. We can also apply for the program because of COVID over the phone. So you can always call the clinic directly, make your appointment with a CEC, and do the entire application process over the phone and renew as well. Next. This is the flyer that's currently circulating. It just gives the basic information of the program, what does it cover, and what are the requirements. And of course, our phone numbers where we member services could be reached, and our website. Next. Thank you. And that is it. If there's any questions, you can always contact the Director of Community Partnership, Ms. Anna Gorman, and I did enter my email into the chat. So after this, if you have any questions, feel free to reach out, send me an email. I'm always happy to help. Do we have any questions right now? Anything that I could clarify? Or are there any questions in the chat?
Hello, this is Veronica, the school counselor. I don't see any questions in the chat, but I just wanted you to just quickly, briefly tell me again the difference between this and it's not health insurance. What's the difference?
Okay, so it's not health insurance because it doesn't meet the minimal essential coverage. In order to be considered a health insurance, you have to meet MEC, which is the minimal essential coverage. This is a health plan, so it only offers preventive and primary care. So we only offer those two services, and it has to be at a medical home. So it's a medical home that the patient's going to select, and that's where it's going to receive all of its services. So let's just say, for example, I select St. John's, and I hear that Altamed gives phenomenal services. So I'm just gonna, take my ID card and go to Altamed and say, I have My Health LA, can I be seen here? They're gonna refuse to see the member because that's not their medical home. He would have to go back to St. John's and be seen there.
Okay, thank you.
Sure, no problem. Do we have any other questions?
I have a question.
Of course.
Just a moment.
Yeah.
Look, if I'm going to cover California, can I buy insurance by there?
That would be a Cover California question. I don't know if Mr. Mancia is still on the line, but
I'm not sure
you
if
could,
he's here.
you do purchase your insurance through Cover California if that's an option.
But
some-
if I'm going to cover California, can I meet Nahum Mancia?
Yes,
Yeah.
yes, I can help you with any questions regarding Cover California and help you shop the different plans available and then also help you enroll.
Yeah, I have to have a appointment or something for you.
Yes, it's best if we make an appointment. That way we secure a spot for you to help you. Or you can call us before you set the appointment so we can do,
Yeah, I took
maybe,
a picture. I took a picture with your name and your phone number.
yes. So maybe let's take it offline so we don't take time from the next presenter. But yeah, give me a call and we can definitely look into
Yeah,
your case.
thank
You're-
you so much. And another question, what means 138% of FPL?
So the FPL is the acronym for a federal poverty level. So for a household of one, that's how we calculate the amount.
But how much is FPL?
So for a household of one, it would be approximately 1,498, I believe. And then it increases
I
by
heard you
175.
Maybe my connection is not very good because I can understand what do you say. Sorry.
All right, we can
Maybe
answer the
maybe you
question.
can write in the chat.
Yeah, we could definitely answer your questions on the side later. But just to reiterate something, so if you guys don't qualify for Cover California and your income is very low, you may qualify for My Health LA. So this is another option for people that are low income. All right. But
That is correct.
yes,
That is correct. And if they're undocumented, so if they're undocumented, they wouldn't qualify for another program that would give them the ability to see a doctor. So this program is strictly designed for the undocumented population of Los Angeles to receive primary care completely for free.
Thank you, Cynthia, for that. So again, this is for people that don't qualify for Cover California or even Medi-Cal. So if you guys are interested in Cover California, please contact Nahum Mancias if you want more information about My Health LA. You can contact Cynthia. Her information is here on the chat, and we'll send her information and information for My Health LA through email as well. We do need to move forward, but thank you, Cynthia, for this information.
Thank you for having me. Have a great day, everyone.
Thank you. All right, so now we have Maribel Franco from South Bay Family Healthcare, which is one of our clinics, local clinics that you guys can visit if you need some healthcare services. So Maribel, are you there? Are you ready?
Hi, yes, good afternoon, everyone. I'm here. I know, Liliana, I don't have access to my camera for some reason. It says the host has stopped it. So I don't know if you have anything on your side, but you're welcome to turn my camera on if you like.
See if that works. If it doesn't work, it's okay.
Oh, there it is. So my name is Maribel Franco. I'm the Director of Patient Enrollment Services or Patient Support Services with South Bay Family Healthcare. We are now officially part of Venice Family Clinic as well. That went into effect this past Monday. So we're in partnership with Venice Family Clinic, which just increases access to care throughout the South Bay and the Santa Monica area. So my contact information is there. My email is a little different now, but I can update it, if somebody needs that. Next. So our mission for South Bay and as well as Venice Family, we share the same mission, is to provide access to quality healthcare for individuals and family. And this is regardless of their income or their legal status. We're open pretty much to everybody. Next. So South Bay Family Healthcare was one of the Los Angeles County leading community clinics and largest safety net providers offering high quality, low and no cost healthcare to medically underserved populations throughout the Los Angeles County. It was founded in 1969 as a South Bay Free Clinic, and South Bay Family Healthcare now has expanded over the last 52 years to accommodate a rapidly growing patient base that will now be part of the Venice Family Clinic. Our we're community located health centers continue to provide services in the South Bay in the cities of Carson, Gardena, Redondo Beach, Inglewood, and now Venice and the greater Los Angeles as we merge with Venice Family Clinic and their sites. South Bay Family Healthcare is part of Venice Family Clinic, an affiliate of UCLA, offering us the ability to expand our services, locations, and programs. Next. So these are our South Bay's current sites in the South Bay. We do have a wellness center located off the Carson High School campus that is open to students and to the community as well. We have our Gardena office on Gardena Boulevard, the Inglewood Claudia Hampton Clinic on La Brea. We also have another Inglewood OBGYN and Pediatrics satellite clinic off of Prairie Avenue. And then we have a Redondo Beach office, which is on Artesia. Next. So there's a little bit of our data on the number of patients that we've seen. These are 2020 numbers, which is probably a little low because of the pandemic for us, but it's the number of patients we saw last year was 16,791. We had over 75,000 visits for those patients. So the percentage of our poverty level, we have a really high percentage with patients who are below the poverty level, which is probably below the 133%. So that's the 71% of our patients. 18% of those are people without insurance. We have the non-speaking and we have the children under 12. Our majority of our patients are Hispanic or Latino descent. And we have the percentages of African American, Caucasian. We have a good percentage of Asian, Hawaiian, Pacific Islander. That's probably mostly at our Gardena site. We have a Pacific Islander doctor out of that site. So a lot of those patients are out of the Gardena office. And then the other percentage is 15%. Okay, next. So this is the information on how to make an appointment with us. It's one centralized appointment center, the phone number 310-802-6170. And our hours are pretty consistent, Monday, Wednesday, Friday, 8 to 5, Tuesdays and Thursdays, 8:30 to 5:30. The only one that's different is our OBGYN appointment center. They make their own appointments. They don't go through the call center. So they're available Monday through Friday, 8:30 to 5. The best days to call are Tuesday through Friday. Monday is our busiest day. So it's kind of harder to get through on Monday. Next. So these are services that we provide. It's a range of primary and preventive care services for the entire family. Adult medicine, which is diagnosis, treatment, follow-up, laboratory tests and medications for acute or chronic illness or any medication really. Chronic disease management, which means detecting, monitoring, and management of chronic illnesses such as diabetes, hypertension, asthma, and congestive heart failure. We offer women's health under annual exams, gynecology exams, breast and cervical cancer screenings, and preventive care. We do have prenatal care at our OB office and the Gardena office, which is comprehensive clinical and supportive care for expectant mothers from physicians, health educators, nutritionists, and social workers. Next. We also provide dental care. We have one dentist at the Redondo Beach site. It's preventive care, cleaning, x-rays, fluoride treatments, fillings, and extractions for adults and children 5 and older. We don't have a dental lab, so we don't do root canals or any crowns. We have integrated behavioral health services, on-site support to help patients meet their healthcare goals or to address common challenges, including stress, anxiety, substance abuse, depression, and violence and trauma. We have pregnancy testing at all of our sites, family planning services at all of our sites, and pediatric care at all of our sites as well. Next. We do have HIV testing and counseling. It's confidential testing along with the mental health and the case management services as well. We have a health educator who specializes in classes on diet, exercise, disease management, and healthy lifestyle choices. Her main population is our diabetic patients. We have an on-site dispensary at the sites where they are dispense medications that come through free programs. And we also have an on-site pharmacy, a full pharmacy at our Redondo Beach office that can fill prescriptions that are made by our doctors. We also have a teen walk-in clinic, which is confidential and free. We have STD testing, family planning services for teens 12 to 19 years of age at all clinics. And we don't need parental consent. That's part of the law in California. And appointments are available by phone. They can walk in. Our Carson clinic that's off campus is open during school hours too. So if anybody needs to, for a student who needs to be seen, they have that available to be there. Next. So My Health LA, I know we have just had a presenter for My Health LA. We are one of those community clinics who accept the My Health LA program. We are a medical home assigned to under the My Health LA program. We do have certified enrollment counselors for enrollment for that. So this is just some information about how to apply for the My Health LA program. So you need to show personal identification, proof that you live in LA County, and something that shows your income. So it could be driver's license, it could be a school ID, anything that proves you live in LA County, the driver's license that has an address on it, a piece of mail, and income can be pay stubs, it can be a statement from your employer, a tax return. We have other forms of verifying income as well. They can write out a statement of their income. That's usually suffice as well. Next. So it's kind of repetitive of the My Health LA you just presented, but it's a program where participants can get ongoing quality healthcare from a team of healthcare providers at a community clinic. It's no cost. It's free healthcare program for low-income residents of LA County who don't have health insurance. You can enroll at one of our sites, or you can call the member services number, like she said, or you can visit their website. So we have access to all that on site as well. Again, who can apply? People who don't have healthcare coverage, who are not eligible for Medi-Cal, who meet certain income and age requirements, like she stated, and Los Angeles residents without immigration documents. So for the undocumented, like she said, like she stated, it's a program for them as well. So anyone who lives in LA County. Next. So again, like she stated, they don't provide any kind of information to immigration. We don't need immigration documents to apply for the My Health LA program. And so most likely they're not eligible for Medi-Cal, depending on their age. So that's who this program is designed for. The clinics that serve you in LA County, they're in the Department of Health Services, that, like she said, won't share your personal information to immigration authorities. And it won't affect any kind of immigration process that the patient might be part of. Next. So we also are part of what they call the Affordable Care Act, which is pretty much the Covered California that was also presented earlier. And so this is the information we would need to apply. We usually, when that application process it's unless they request documents are uploaded, then that's the time to do it. But our certified enrollment counselors are part of the Covered California program for comprehensive health coverage, and many of this for the first time will have insurance through Covered California. These are some of the requirements. It goes under Medi-Cal as well. You know, the U.S. citizen or legal resident, an income below 138 of poverty, that's for Medi-Cal. Children at or below the 250, I think that's actually a little higher of the federal poverty line. And then for Covered California, I'm pretty sure, I'm not sure if it's been updated on this slide. But if you don't qualify for Medi-Cal, you'll fall into the Covered California health plans, and if you don't receive coverage through your employer, you can also apply for Covered California. Next. So the document that you need to bring to apply for either Medi-Cal, Covered California, that are suffice is a passport, certificate of naturalization, certificate of citizenship, or permanent resident card. If you don't have anything, then we have a military ID, driver's license, or a school ID. For income verification, any pay stub, a copy of the income tax return, or again, a letter or an affidavit signed by your employer. Next. So these are our enrollers. So we have an enroller at each location. They can provide consultation, free information, or they can do the enrollment into Medi-Cal or a Covered California plan, also the My Health LA plan. Each of our locations has a enroller on site. Next. These are our enrollers at the different sites. This is their contact information. So there's 4, the only one that doesn't have an enroller on site full-time is our OBGYN office on Prairie. But there's an enroller at every site, including the Wellness Center at Carson High School. Next. So we now offer telehealth services. Next. And this is an event that we have coming up for, it's a senior health fair event, and we are usually out in the community at a lot of these events, just presenting our services and access on how to, information on how to access our services. This is the upcoming event that's coming in November 19th. It's in the Gardena City at the Nacopa Community Center. And it's usually free for everybody. So they offer various screening, medical screenings. So usually they'll do diabetic screening, blood pressure screening, again, with access to medical facilities for follow-up. Next. So if you have any, we're also doing COVID testing. We have Moderna vaccines at all of our sites. You do have to be a patient of South Bay Family Healthcare to obtain those services, and it's only by appointment. We have to do the screenings for the vaccines as well as the testing. And our pharmacy on site at Redondo is also doing the testing. And we do follow the strict COVID restrictions for anybody who wants to visit any of our sites. So if you have any questions on our services or our locations, I'll be happy to answer. Again, we are part of Bennett's Family Clinic as well, so we have access to other sites that are outside the South Bay area.
All right, does anyone have any questions? I'm gonna just wait a second.
Okay.
I don't see any questions, but thank you. This is definitely a great resource. It's very nearby. So hopefully students will visit the clinics. Thank you again, Maribel.
You're welcome. Thank you.
So we are going to move forward. Now we have Stacy, who's going to be talking about home instead senior care. Stacy. Stacy, can you hear me?
Sorry about that.
No worries. Let me go ahead and get started. Stacy, whenever you're ready.
Okay. Are you going to show the video or you want me to talk first?
You can just speak a little bit about what home instead is, and I'll show the video
Okay.
after.
So basically, home instead is, oh, I'm sorry, you guys. I forgot about the camera so you can see me. There, no better. Home Instead is one of the largest in-home care providers in the country. Our main audience is seniors, and we offer home-based care for older adults and that specialize in non-medical. So it's basically about companionship to help seniors live safely in their homes. And so most of your speakers today are talking about healthcare. So thank you to Liliana for squeezing me in, because I'm really coming here to talk about jobs for seniors. So, but it's kind of in the healthcare, you know, quasi healthcare. One of the things that's really important for seniors is social interaction, as I know we all, you know, kind of heard about during the height of the pandemic, you know, where people are looking through the window at their loved ones. And so one of the things that we kind of alleviate is boredom, loneliness, and, you know, giving them some of their essential needs. So for us, what we're looking for, first of all, you must love seniors, the most important thing, and you have to have a clean criminal background, completely clean, and you should have a car with a current driver's license, and that's about it. It's really easy as far as applying and qualifying. The work can be very gratifying, but like I said, you must love seniors. And you can apply online, or you can come into the office and fill out an application the old-fashioned way between 10 a.m. and 4 p.m. And my name is Stacy, and I am the HR manager and the recruiting manager. And I'm going to turn it back over to Lily. She's going to show you our little video. Can't hear.
You can't hear the video? No? Okay, give me 1 second. Sorry about that. Let me reshare.
Home. It's so much more than we think.
It's comfort.
It's memory.
It's sights, sounds, and smells.
It's safety.
It's love.
It's hope.
Even in the final hours.
When the world begins to fade.
It's part of us.
It's home.
Home is not just a building.
Home is care.
And you are a caregiver.
You empower people to stay at home.
That is the greatest gift you will give.
Through the work you will do.
You will give home back to aging adults.
It's a hand to hold.
It's a loving look.
It's being a keeper of memories.
That may be lost without you.
It's a good meal.
A watchful eye.
A listening ear.
A patient heart.
It's laughter.
And it's tears. It's hurt.
It's healing.
It's caregiving.
Do you know how it feels to change someone's life? You will.
You will.
You will.
Caregiver. I am a caregiver.
I am a caregiver.
I am a caregiver.
I am a caregiver.
I am a caregiver.
I am a caregiver.
And now you are too.
So one of the questions that came up was somebody was asking about actually needing the service in another city. So of course, the flip side of being a caregiver is that of course we need clients to stay alive. So yes, if anybody is looking for help for their loved one to stay in their homes, yes, you can please contact me. And if it's not within the South Bay area, we do have other home insteads, and I could refer that to you if you have difficulty finding it. That is it. Does anyone have any questions? Okay.
I just have a quick question in terms of the hours. Do caregivers have flexible hours, or how does that normally work?
So absolutely, caregivers do have flexible hours, and we try to work within your schedule and within our schedule. However, most of our shifts are either 4 hours, 8 hours, or 12 hours. And they might start like 9 to 1 or 12 to 4 or 4 to 8 or 8 to 8. So while we do have some basic parameters, we try to stay in. We always need weekend people, and there's always a shortage of guys because some male clients do not want to work with the ladies. And there's usually some sort of shift that we can fit you in. And if there's not, then, what we do is, you might just do a couple of part-times here and there until something comes up. The thing you got to understand about this industry is that it's forever changing. Our clients go into the hospital, they pass away. We get new clients that come out of the hospital or now just need care. So it's sort of like moving sand. So our needs are always just sort of changing, and we change with them.
Great, thank you. Does anyone have any questions? No, well, I'll definitely be sharing this opportunity with our other students. I know there's many students who can attend today and may be interested. So thank you for that.
Thank you.
Okay, so we have about 7 minutes, but we're going to continue on just to give you guys a quick overview of mental health and some services. So Veronica, when you're ready, you can go.
Okay. Hello, everybody. Let me see. Do I need my camera on?
Yes, you're good.
I'm good. All right. Thank you. Hello, everybody. My name is Veronica Nieves. I am the school counselor here at the Torrance Adult School. I help students with their academic plan and their goals. And I also help students who need help with referrals, for example, for mental health. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Next slide. Some signs of stress. Some signs that we have of stress could be excessive worry or fear, feeling excessively sad or low, confused thinking or problems concentrating and learning, extreme mood changes, prolonged or strong feelings of irritability or anger, avoiding friends and social activities, changes in sleeping habits or feeling tired and low energy, changes in eating habits such as increased hunger or lack of appetite, difficulty perceiving reality, delusions and hallucinations, overuse of substances like alcohol or drugs, and multiple physical ailments without obvious cause, such as headaches, stomach aches, vague and ongoing aches and pains, and inability to carry out daily activities to handle daily problems and stress. Did you know that the following can affect your mental health? So if you work too much, which is called being a workaholic or workaholism, the stress, and everybody's experiencing stress nowadays. If you're feeling burnt out, if you don't know how to establish boundaries and say no to certain things that fill you up positively versus saying yes to things that don't. For example, remember that you should have boundaries with how you're coping with stress, making sure that you're not overeating or eating things that are not healthy for you. If you're also don't have boundaries around people pleasing, that's an important skill to learn. And we all need to learn these skills, when to say no and when to say yes to certain people and certain situations. Wanting to be a perfectionist is also something that can affect your mental health, because you never feel like things are absolutely okay. And you need to learn to work through the issues of perfectionism so that you can live life without feeling like without feeling low or having low self-esteem. Life, and we all have low self-esteem, but there are ways that we can cope and become higher, and that allows us to have higher self-esteem. So also life changes and transitions affect mental health. For example, through COVID, there were many transitions we all experienced, working from home or working from home with our families and our children, having to learn new technology. So all this contributed to our life changes and contributed to our mental health. And then also having compassion fatigue. We all feel compassion for people, but when is it over the top? When is it so much that you cannot, you lack a sense of energy for yourself? So these are all things that can affect our mental health. If you need any service for mental health, one of the first places to seek that service is through the mental health services in LA County. As you heard about how to get insurance, you heard about a different program that can help people that are low income and undocumented get services for physical health, but you also need to make sure that you're getting services for your mental health. So if you're ever feeling low, or you feel like you just need someone to talk to, or you just can't seem to find a solution to your problem, it's always important to reach out. The phone number here is 1-800-854-7771. It's accessible 24/7 for help with regards to mental health or any worries, or even if you're feeling very low and thinking about suicide. And also there's other apps that are available that you can download on your phone, whether you have an iPhone or an Android, that are very helpful in helping to reframe your thoughts, stay focused, and stay in a place until you can get more clinical mental health services if that's what you need at the time. Next slide. All right, mental health resources. So as I indicated earlier, you can check out the lacounty.gov mental health services department. There's also free mental health centers through the website called freementalhealth.us. You just enter your zip code. Our zip code here is 90504. When you enter that zip code, it will have a list of places nearby where you can get mental health services. For example, one that is nearby is on El Segundo and Hawthorne. It's called Behavioral Health Services. Another one is called the Coastal Asian Pacific Islander and Mental Health Clinic, which is in Gardena. For families. Sometimes families have specific need. They need to seek mental health services, not only for mom and dad, but for their kids, sometimes individually, but sometimes together as a family. So there are a couple of services that are available. One is called Care Solis. It's simple, fast, and safe tool for drug and mental health assistance, and it's provided by TUSD for families, and it has 24 hours, 7 days a week assistance to find services for children and adolescents and adults or seniors, regardless of insurance. So that's an important one. It's specifically also for, like I said, for parents who are experiencing these issues, or have children that are experiencing these issues, or anyone in the family experiencing issues. There's the South Bay Children's Health Center, which provides mental health and counseling to low-income children in the South Bay for families with Medi-Cal. And that one is located in Redondo Beach. There's the Children's Institute, located on campus of the Harbor UCLA Medical Center. It provides counseling and for parenting as well, and parenting classes, I believe. Then there's another service called Counseling for Kids. Counseling for Kids provides therapists that travel to the child's home or school to provide therapy for families with Medi-Cal. Next slide. South Bay Family Connect. South Bay Family Connected, its mission is to improve K-12 students' social emotional wellness. What they do is they connect parents and guardians and teens with valuable resources, education, and support, as well as reducing the stigma around mental health issues and sparking conversations that inspire people to reach out for help when they need it. So they have a variety of services available for a variety of topics, such as suicide prevention, mental health, stress and anxiety, social emotional wellness, mindful parenting, empathy and compassion, and so on. The following on this slide, I just wanted to share some hotlines. Many of us are still at home, or because of COVID, we do not want to go out and about, or we don't know where to start when we want to find somebody to talk to about our mental health condition or our mental or what we're feeling emotionally. These are some numbers, some hotlines that you can call. Most of them are available. I think all of them are available 24 hours, 7 days a week, and they're for different situations. One of them is the National Suicide Prevention Crisis Hotline. Another one is just a crisis hotline for whatever crisis you are experiencing. The Los Angeles County Department of Mental Health Access Line, Depression and Bipolar Support, Crisis, Disaster, and Essential Needs number, which is all you have to do is very simple. You just dial 211 and the hotline for substance abuse. Okay, so like I said before, my name is Veronica Nieves. I am the school counselor. I help students with primarily the academic plan, but I also help with mental health. And we have started a series of presentations for students to address mental health issues, specifically stress and anxiety. What I focus on is this wellness component that is complementary to mental health and clinical services. There's a lot of things that we can do, and we need to gain the awareness of what we can do. Simple things, proactive things, such as breathing, but breathing techniques that help with meditation, with calming techniques, stretching, all these things, sometimes things that we take for granted, that we need to be aware of, that we can use every day in our lives to help us with stress and anxiety. I have a Counseling Corner website. The Counseling Corner website has some basic resources to help you understand what anxiety is, to help you with productivity, to help you gain a more growth mindset and be more proactive in your approach to help you with stress and anxiety. Next slide. We recently had our first stress reduction workshop. In our first stress reduction workshop, we did some activities, some breathing activities, and I gave you some tips and techniques as to how to think of stress differently, and that will help you feel calm in certain situations. We're going to have a part two. Part two is coming Wednesday, November 17th, where I will discuss more of these techniques to help you deal with stress.
All right, thank you, Veronica.
Thank you.
All right, give me 1 second. All right, so that is it for our presentation today. So tomorrow we are going to have another resource day, and it's going to be our final resource day. Tomorrow we're going to focus specifically on income, food, and housing and childcare. We actually have some really great speakers from that will be presenting tomorrow, including the Department of Social Services, which handles the CalWORKs, CalFresh, as well as Medi-Cal programs. We'll have WIC, which stands for Women's, Infants, and Children program. It's a food program. We have New Challenge Ministries, LASA, which helps, which is a homeless, Los Angeles homeless department that works with works to combat homelessness in the area. And then we have Connections for Children for those looking for childcare. And we also have the YMCA that also offers different childcare programs. So we have many great speakers tomorrow, and we hope that you guys will be able to attend. It will be again from 12 to 1:30. Here is our contact information in case you guys do need to contact us. The first one is our phone number. Then you'll see two websites. You have the tusc.org/TAS website, which is the Torrance Adult School website. And then you have the bit.ly/TAS-support. That is the Student Support Services website, where you can find some of these resources that we shared today. Also follow us on social media. You can follow us on Torrance Adult School, Facebook, the Instagram, the Twitter, or YouTube page where you'll find the recording of this video. Again, thank you guys. And if you do have any questions, feel free to contact us.